a year and they wasted it completely on election rallies and all the other stuff.
Allahu Akbar. Assalamu alaikum wa rahmatullah. I have money, I have everything, but I can't save my sister. No gas, no oxygen, no bed. Where we can go?
Full India is a problem.
Good evening. You're watching Left, Right and Centre. On the show tonight, as the United States, the United Kingdom, the European Union and the United States announce that they are moving in with the help India needs to fight this COVID crisis, we look at what's happening today in our big cities. Those were images you saw of Delhi. On the program tonight, Delhi, Kolkata and Bangalore, we discuss the rising positivity rate. Does this mean that after Delhi and Mumbai, some of our other cities could be headed to deep trouble as well? And then the big question, just where is this all headed? We speak to one of the world's foremost epidemiologists, Dr. Eric Fiegel-Ding, on the numbers, the projections, the vaccines and variants. It's an interview that comes up on this program in a few minutes, about 10 minutes from now. It's an interview you don't want to miss. Well, joining us now, Dr. Kunal Chorkar, cardiac surgeon with Medica at Kolkata, Dr. Vinay Kantru, Senior Consultant at the Pulmonary Critical Care of Apollo Hospitals, Delhi and Noida, Dr. Ravindra Mehta, Chief of Pulmonology at Apollo Hospitals, Bangalore. Thank you all very much for being with us. Dr. Chorkar, let me come to you first. We have seen the positivity rate in Kolkata, according to some reports, more than 50%. Is it your big worry that in the days ahead, the number of people who get sick in Kolkata could rise dramatically?
Vishnu, indeed so. And like the rest of the big cities in the country, we are also trembling in our shoes. And remember that West Bengal happens to be the most densely populated major state in the country. And the kind of nuisance we had to put up with this 8-phase election with numerous rallies and road shows, we think, the worst is a little bit ahead of us. The healthcare infrastructure in the state is already overwhelmed. We are massively overwhelmed. There is a tremendous lack of critical care and oxygenated beds. And everything put together, I think, these statistics, these numbers, to a clinician on the ground like myself is meaning less and less every day. Because once I think healthcare infrastructure is massively overwhelmed, I really think that these numbers and these statistics will sound very hollow, and a lot of it will cease to matter as far as those of us who are trying to make a little bit of an effort to save a few lives are concerned. And one more point I would like to make, that a tendency which is really aggravating the problem right now, please raise our voices so that oxygen is not hoarded in the form of tanks and all and being pilfered all across open market and shops, because this is something which is greatly aggravating the oxygen crisis. It is not a capacity problem, it is a storage problem, it's a distribution problem. And everyone seems to have 3 cylinders of oxygen in their home. The government is announcing capacity less than 10% of which are oxygenated beds. So all in all, rather than being a part of the solution, it ends up being a part of the problem. Okay. That is something that we've got to focus on.
Dr. Mehta, could you tell us what you're seeing at your hospital at Apollo in Bangalore? Is it the same situation, fewer beds, rising positivity and a worry about oxygen?
Yeah, so it's the same situation, Vishnu, just different language, the same cataclysmic, horrible mayhem-like situation, because it's going too fast. COVID has this peculiar thing that they come in, at the speed of lightning, but they go out as slow as a snail, We can't discharge people. The ICUs are clogged up. It is impossible to create capacity. And this oxygen issue is something which is the Achilles heel right now. We have beds, but we don't have equipped beds which need oxygen. So empty beds in massive hospitals with great infrastructure without the lifeline of oxygen. So it's now, and secondly, the worst part is this young predilection in this pandemic right now. We vaccinated our elderly, the young have been mobile. There is a greater percentage of younger people we see. We know the ICMR guy said no, but we see otherwise right now. And these people are struggling, coming in late, and it's impossible to accommodate them. It's a completely overwhelming situation at this point. And if something has to change, otherwise we will see numbers like UK, New York, all those guys who went through, Italy for that matter, went through a horror in the last year or so.
Dr. Kanchu, has the oxygen situation improved today at Apollo hospitals in Delhi and Noida?
Well, see, the oxygen problem is a huge problem. Luckily, we have been lucky in the sense that we haven't actually seen that mayhem. We have been able to restore the oxygen supplies till now. But considering everybody is facing, short of the shortage of oxygen, I do think that we need to sit down and the leaders, they need to find out a way so that these resources, which are absolutely essential at the moment, they are given a green tribunal wherever it is required, and we get an uninterrupted supply of these essentials. You know, our hands are tied down. We can write the medicine, we can write n number of prescriptions, but we need to have the resources and the manpower to take care of those orders. So absolutely essential commodities. We do need intervention from the higher authorities to get things in place.
Dr. Sarkar, one more quick question to you. Clinically, what are you seeing on the ground? Are you seeing younger people as in terms of patients? Are you seeing longer hospitalization? Are you seeing more distress in the lungs?
Vishnu,
see, the problem this time has been the...
one sec, I just wanted to ask Dr. Sarkar. Go ahead, Dr. Sarkar, yes.
Yeah, I think, sorry ma'am, I think, it was almost all of that what you said, as Dr. Mehta has already outlined for us, because we have managed to vaccinate the healthcare and the senior citizen category. The poor young people are coming in desperately sick. And what is also more important, Vishnu, this time round is that we cannot depend upon our past experience that the storm or the blast comes at the end of the first week. It is coming much sooner right now. People are becoming desperately sick within 3 to 4 days. So all our past memories of COVID treatment we are carrying with us, the grammar seems to have been shattered. And mind you, in most of the cities, we are also seeing a good number of children who are getting affected. Thank God for the fact that most of the children are managing at home. Not many of them are needed to come to hospitals at the moment. And our appeal should be to all governments that focus on oxygenated beds. Just a bed with a bed sheet and a drip stand is completely inadequate for this form of treatment, and it gives a false sense of security to the people and to the people who are following the journey of this pandemic by and large. We have to create meaningful capacity. Shallow capacity does not mean anything at this point of time.
All right, well, that gives you an idea of the situation in Kolkata, in Delhi, and also in Bangalore. But I think the larger question really is, where is this all headed? I spoke to one of the world's foremost epidemiologists, Dr. Eric Fiegelding of the Federation of American Scientists, who's been tracking this statistically and where this is headed. And some of his observations are just frightening. With India recording a record number of cases in a period of 24 hours as far as COVID is concerned, and with this new surge in COVID cases now being spread to large parts of the country, and with oxygen shortages being widely reported, in addition to problems in hospitals, people struggling to get a bed, the big question which so many people are asking is, how much longer? When does this peak? Where exactly in this particular surge does India now lie? Joining us, one of the world's foremost epidemiologists who has tracked every aspect of COVID, Dr. Eric Fiegelding. He's an epidemiologist and senior fellow at the Federation of American Scientists. Dr. Fiegelding, good to speak to you. So my first question is that, is it possible to project when India starts peaking with this surge in infections?
That's a good question, and I think India right now, it's going to get worse before it gets better. I'm hoping that by mid-May, things will hopefully start trending down again. The deaths will hopefully start dropping. The Institute of Health Metrics and Evaluation, they think May 17th is a day in which the deaths may start slowing, not coming down that fast though, start slowing. But that really depends on how much masks, how much vaccine rollout there is, how much other mitigation, and if people follow the distancing.
So Dr. Fiegelding, by then, what could India's daily addition of cases be on an average, 7-day rolling average? It's already well more than 300,000 at this stage, and more importantly, deaths. 3,500 approximately now. In the next few weeks, how high could this rise?
I think we could easily rise, well over, 1 million. And the thing is, the data in India right now is very poor. As you know, cremation numbers do not match the number of reported deaths. That's been widely reported. We're talking about 20 to 50x difference in the number of daily deaths from crematoriums versus reports. And this is where the uncertainty, some people say cases are 2x underreported, some people say 5, some people say 10x underreported. So in terms of the true death toll, we won't be able to know until much later, especially in some of the rural areas, which has even less testing than some of the cities. So I think, honestly, India is well on its way to 1 million deaths a week, but most likely 1 million deaths, not a week, but I think 1 million deaths by August, but probably it's going to be over 5 million by August. And by May, I cannot really say because we just simply don't have enough data.
So 1 million deaths by August, right?
And you that's mentioned conservative. That is what the epidemiology models currently say. But that is based on current reported deaths.
So let's stick to that for a moment. And I take your point, Dr. Fiegelding, that it's being underreported. I take your point, and we are reporting the same concerns of underreporting. But just for a moment, if we were to stick with the official numbers, they are still astounding. 1 million deaths by, when did you say? By August,
August 1st.
By the 1st of August at this rate. So what does India need to do to curb these numbers, to cut down on these numbers now, to prevent it from getting to that level or more?
Yeah, I think what the government right now needs is to have a countrywide slowdown and really have curfews and people basically not go out, but also the government at the same time give free aid, make sure people are fed, people won't starve, and all this, no more public gatherings, no more of these large political rallies that we've been seeing. That is so dangerous. And we need to stop the misinformation and also threatening people about oxygen shortage or deaths. Those definitely are happening, but do not threaten people for speaking out on these kind of issues. It is critical that we get the truth and that the government allows the truth to get out of how many people need oxygen, where we need it, where we need to see more cases and measure more and test more.
And Dr. Fiegelding, I just wanted to, so that we report this accurately, you're looking at 1 million potential deaths by the month of August for just the second surge?
Yes, for just this surge. By the time the daily deaths climb and start slowing down, but cumulatively it will still increase. The IHME, Institute of Health Metrics Evaluation in the University of Washington, Seattle, is saying 1 million deaths conservatively by August, early to mid-August. And that is not a number that is impossible. We think because of the undercount that it will be likely 2 to maybe 3-4 million deaths by then. But we just simply don't know. But the most conservative, based on current measured cases, is 1 million. And that is why it's so scary, because 1 million is the lowest number that we probably will get.
Yeah, no, that's very, very frightening indeed. All right. Now, in a situation like this, vaccination, all important. I mean, vaccine hesitancy, what's that? That's a luxury no one can afford. But we have a production glut right now. We have a production problem right now. We used to have a glut. Now we have a production problem for various reasons. Now, America has a large number of AstraZeneca shots which are available. It's not cleared for use in the US. Does it make sense to transport it over here on the basis of the great friendship we have, humanitarian grounds, call it whatever you want?
Yeah, I think it makes sense. The only problem with that is Trump White House Operation Warp Speed vaccine contracts say that these Trump-produced vaccine-era vaccines cannot be used outside the United States. It's written in the contracts. But the Biden vaccine, the new vaccine batches that Biden White House has ordered do not have them. And so starting in May and beyond, when those new batches of vaccine, they can be shared with the world. And right now, the Trump era vaccines that we have cannot be shared unless we break contract. And so that gets to my point. I actually think that the U.S. should just break those contracts. It's a humanitarian crisis, and get them shipped to India and shared and shipped to Brazil and all these places in the world that clearly needs our help. And the other way is U.S. has been known to ship these vaccines to other embassies abroad, and because it's still U.S. Sovereign territory. So another way is to have vaccinations done through the U.S. embassies and have people just offer the vaccines there at the doorway. I think that could be another way, but we need to really be creative and really deploy these vaccines for the world.
Dr. Fiegelding, there's a very common question that is asked. People now say it's airborne. We knew that it was droplets. Our strategy was on the basis of droplet mitigation. Now it's airborne. So the question being asked is, how far is it airborne?
Yeah, it's definitely very airborne. It's not surface contact for most parts. It's not touching dirty door handles. That is not what is the main spreader. The main spreader is an airborne virus that will float in a room long after someone who had the virus and was breathing into the room has left. And so you can see, you can enter a bathroom in which someone had already breathed into it, but you think you're alone in the bathroom, it's still there. And so indoor is the riskiest. So opening windows is so key, and not just one, but two windows or doors, that way to create a draft.
Right.
But this is an airborne virus, and we have to really treat any air that anybody breathes as potentially infectious and really ventilate and open all windows to reduce that kind of spread. And 6 feet is not enough.
And outdoors as well, is that the case? Does it obviously disperses more outdoors, but are we still at 6 feet? Some people say 20 feet.
No, outdoors, obviously the air dispersal is faster. But if you have a crowd of people, like these massive political rallies, that is not safe. It's not safe in any way. And that's why I want to emphasize that 6 feet rule, yes, generally follow it. But indoors, there is no safe distance, I want to emphasize. Outdoors, if people get too crowded, it's not safe either. And this is why you really want to keep a distance in the outside. It just combination, do all of it. Distance, ventilate, test people, and isolate, and border quarantines, and all these kind of things that will actually slow the disease down. And of course, vaccinate. But vaccinate, you have to the difference between vaccine and the virus is, for every person unvaccinated, I don't have 5 other syringes to vaccinate 5 other people. But the virus, for every person infected, that person can infect 5 other people. And this is why we're losing this race against corona. We have to do other things to slow it down in addition to vaccinate.
What is the efficacy of AstraZeneca, what we call Covishield over here, and even Covaxin, which is the other drug, which is, it's not, their phase 3 results haven't been peer reviewed, but they've been announced. They're fairly encouraging at about 80-odd%. So let's take it at face value. How well does that work with one dose? Because a lot of us have that question. For example, I've had one dose of AZ, right, of Covishield. and I'm still a few days away from getting my, so how protected am I?
You have some degree of protection, but it's not the maximum. I would say you probably have, half to 2/3 of the protection you would have from the maximum. And the other key thing is asymptomatic transmission, especially against the contagious UK B.1.1.7 variant,
Yes.
and likely some other variants. The asymptomatic is much lower because the virus, again, for mild asymptomatic, it can spread more. In one Lancet paper, it was 29% for AstraZeneca Covishield for asymptomatic UK variant. And so this is why you have to still be very cognizant. Get both doses, but you still have to assume that maybe you can still transmit. You won't get very, very sick and you won't die, but you will still potentially transmit. So this is why you still have to mask even if you have the vaccine.
All right, final question, and the variants. Now, as far as we know, on the basis of genome sequencing, which is still very low in terms of numbers in India, that it's not just the double mutant, it's also the UK strain over here. There is also talk of a triple mutant, this, that, and the other. But on the basis of what you know thus far, what is the dominant strain going around now? Or, yeah.
Mm-hmm. So that's a very good question. Dominant strain worldwide, I would say by now, is the UK variant, and in Brazil, the P1 variant. In India, the problem is we don't have enough sequencing. India does not have enough testing, and on top of that, it does not have enough genome sequencing to read the full genome to know which version, which variant it is. And based on what we have so far, it seems that the B1617, the double mutation, and there's another Indian variant, B1618, are rising pretty quickly in India. And we just don't know exact efficacy, but we know that the mutations it has in other variants have caused a degree of reinfection. And basically, even if you got infected last year, you can still get reinfected with this year. As well as potential immunity escape. And hopefully that won't mean that vaccines won't work, but it might potentially lower vaccine efficacy a few percentage points. So this is why it's troublesome. And we thought that India had conquered it, but clearly it did not. Some people said there was herd immunity. Some people said, the T cells from last year's infection will protect us. Clearly, those people were wrong. Yeah. And this is why we have to take the precautionary principle and assume that this new variant is causing the surge, which many epidemiologists agree, and we have to vaccinate. It is a race against the virus. The virus will infect 4 to 5 additional people for every person it infects. But right now, our vaccines do not grow exponentially like that, and this is why we are losing this race until we do other things while we vaccinate. We have to slow down the virus.
All right, Dr. Fiegelding, thank you very much for speaking to us and sharing your concerns and a look at the trends that you now see as well. Thanks very much indeed.